Hi, good evening, ladies and gentlemen. Thank you for staying back for this going to be long sessions until 6, right? So I'm Dr. Peter Chung from Kuala Lumpur, and with me here, Dr.
Dr. Elena, I'm from Russian Federation. Nice to meet you all.
Yeah, so today we're going to have a live demo of these several new machines. Some I don't even know what they are. So I'm also here to learn about these new machines here. So our first speaker is going to be Dr.
Chenist.
Chenis, right?
Can you hear us?
We can't hear you.
We have a great picture, but without.
Yeah.
Hello.
Ah,
Yeah,
yeah. Okay, gotcha.
Dr. Chenist.
Can you hear me?
Yeah.
Can you
Yeah.
hear me?
Yeah. So you're going to demo on
Hello.
two machines here, right, Dr. Chenis?
Yes, two machines, the Liftera 2 and the Cool Face.
Okay.
Yes.
So over to you. Just go ahead, explain to us. And feel free to ask any questions.
Okay.
Yeah, we can always interject and ask him questions. Ask Dr. Chenis the questions. Yeah?
Okay. So now let's begin the treatment. Yeah. Starting with the Liftera 2 is a new device, and I have used it for quite some times, for a couple of months. And this is the applicator. The applicator is like the competitor to the Ultralight Prime or Ultralight, the very famous HIFU. But this machine used to is like used some kind of thermal zone that can help to stimulate the smash or the muscle inside the face of the chubby face or even the sagging face. It can improve the outcome. Okay, let's start. And this is like the gel, like the IPL gel or the aloe vera gel when you use it. The thing about the Lipsla 2 is quite very comfortable if you use it, and with less pain or less tingling sensation. So starting with we apply the gel on her face, and then we adjust the level. Mm. You can start with level 7, and then I think for my evaluation, I will do it around maybe 600 shots today, 300 per side. Okay, so now we
So
adjust
Dr. Chenis, so first of all, right,
three.
we are doing
Yes,
this for skin lifting, right? Are we?
yes, for
Yeah,
skin lifting.
for skin lifting, right? So
Yeah,
do
yeah,
we
for
have
skin lifting. Yeah, finger skin.
is it possible to sit up the patient so that we can look at how saggy the skin is before the treatment?
Oh, yeah, yeah, yeah. Yes, yes, you can see her first.
Yeah, because then you can tell us about
This
your
women, you try.
assessment, where should we target?
Yeah. This woman, 27 years old. เดี๋ยวต้อง zoom ดู As you can see, she got a lot. Actually, her problem is about massive fat tissue. But for the sagging, for the problem about the aging, it's not quite obvious. It's about the chubby face. But for this kind of problem, if we use the cool face, it's like mixed with the lip salad. They help each other. They help together to stimulate some thermal coagulation in the skin tissue, and it will be like smaller after 1 or 2 months.
So our target is still the smash,
As you can see,
right?
smash. Yeah, our
Right.
target.
So we are not targeting the fat in this case, right?
We're not targeting the fat in this case. But for the cool face device, when we it's like when we do the energy, it passed through. It's passed through for the fat tissue and for the smash as well. Mm.
Okay.
เอาด้านล่างนี่ Okay. นี่เจ็บไหมเจ็บไหม so now I'm beginning this is the yeah the button if
You
you can hear the
start
voice
with 4.5, yes, introduction level.
4.5
Yeah,
millimeter
yeah, yeah.
yes
After that, you can use 3
Yeah.
millimeters. After that, is skin, yes?
For this women because he got a lot she got a lot of tissue so we can do 4.5
Okay.
millimeter for the whole face but if you do on the upper face maybe if we evaluate that oh this is but she had got not so much problem on the upper face so maybe we don't do anything to the upper face we do on the lower face only
But lower face also, would
and you
you
can
like,
notice that
meaning if this area, would you do 4.5 followed by 3, followed by 1.5, or you just do 4.5 only?
just 4.5 just stick with the 4.5 but I think if you think she had got the problem on many layers of the skin you can do like that you can adjust the depth of the applicator but for me I think 4.5 for the whole face is all right for this case
Is there a danger zone that you avoid?
Uh, actually, there is some danger zone, but for my experience, if we don't do repeatedly on that zone, it should be fine. Like maybe if you be aware of the buccal nerve and we don't if we don't do it too much repetitively, I think it should be fine. And another thing, we can ask her if we can communicate with the patient. We ask her that oh how do you feel? Do you think it's too painful? But this women maybe doesn't feel anything. So we can increase the dosage. We can increase the level a little bit. Maybe 9 like that. But from my experience, like some patients when they get older, we can do it even reach to level 15 without any side effect. Okay, now we change to level 9. เจ็บไหมนิดหนึ่ง okay. She said that she can stand the pain just a little bit เดี๋ยวจะใส่อันนี้เพิ่ม and we need to keep the applicator contact to the skin ใส่เยอะ
Do we need numbing cream
okay like this
for this procedure?
no need for this device no need because this device doesn't cause too much pain อะไรนะได้ okay so now we try to lower the bed and this is the end point the minimal redness you can see that her skin changed a little bit and we need to keep the applicator contact to the skin and sometimes we can use another hand to help because it's like when the machine spread the energy if we try to make it too lovely ไม่ค่อยเจ็บนะ
How many impulse you
Okay,
can
let me
have
see.
a plan to be in this area?
Sorry
How many impulse you have a plan to be in this area? To do in this area?
oh actually
100.
I plan around maybe this area 100
Yeah. Okay.
and for the lower around 200 yeah, like that เจ็บไหม
Some pinch.
นิดหนึ่งโอเค and this machine can do even on the platysma muscle on the neck And you know, I have many friends, many friends as a doctor. They will feel really anxious when we do it on the neck muscle because sometimes there are many vessels here.
Yeah, not
But
only
as I did it for maybe three, okay. Any question?
yeah, not only vessels, but sometimes when we look under visualization, right, I see that a lot of times the smash on the neck is only up to 3.0. The 4.5 is as if I'm hitting the sternocleidomastoid muscles only.
Yeah. That's sometimes we aware of that, but it's like if we do it too superficial, they feel more pain. If you do it too superficially, they feel more pain. So I think maybe 4.5 millimeter, it leads to the fat tissue sometimes.
So if the energy is
เป็นไงบ้างครับ
strong enough, right, we could potentially cause fat atrophy
Yep.
also, right?
Yes. Now we increase the level to level 11, which is all right. The company may say just 4 to 8 is all right, but if she can stand the pain like this, she can stand the heat, we can increase the level. Or maybe we can make the record, and next time if we do to her, we can increase the level.
So
Also.
so far, right, do you have any complications, and roughly how long have you been using these machines, and over this period, have
The
you
complication, no serious complication. But when you did this, when you are doing this, you need to be careful for some area. Like this women, if she got the trachea, the airway in the midline, you need not to to attack her trachea because sometimes if we put the energy to the trachea, she like cough like this. But that's all. So in my perspective, this device is really safe and easy to use. I have used a lot of devices before, but this device is really very comfortable. เป็นไงบ้างครับเฉยๆเนาะ She said that she feel fine, but we need to keep it contact. We cannot do like if uh, you can see this if you like. When I put this, you can see that there is some change on the gel. That means the power, the energy came out. So we need to put it contact, keep contact to the skin. If we raise the hand and we put the energy, and there will be some burn issue. So need to be careful.
so when
But
is
from my perspective, I don't do like that. I keep contact all the time. Keep
Why
the
you
skin contact
prefer
to the applicator all
introduce
the time.
4.5 millimeters, then maybe 3.0? It will be better, no?
Or because
On this
like
area.
I told you, I think if it's too superficial, maybe you feel pain. She will feel pain.
but maybe the pain
อันนี้
is
เฉ
where
ยๆ
the target is going to be. Because if we target the smash, yeah, we know then
Yes,
it's painful. Maybe we target the fat, maybe less
yes,
painful.
Yes.
uh.
Yeah. That's the thing. So in some older patients, if you want to focus on the smashed tissue, maybe you need to adjust the depth. But she may she may experience more pain.
So when you want to change, right, do you have to change the whole tip? The I don't know, is there a consumable there? The black color, do you change that tip?
เดี๋ยวเราเปลี่ยนหัว Okay, now we gonna change the tip to 3.0. But now the time is running out. So now I will show you to change to the 3.0.
Right.
อันนี้ก็จะเป็น 3.0
So that's the consumable, right?
แล้วเจ็บก็บอก This is the 3.0 millimeters. Yes. เจ็บมากเลยเฉย
So is it a
She said she
consumable?
doesn't feel anything.
That means after certain shots, then we got to get a new one, the new transducer, is it?
Uh, yeah. When we run out, it's like we need to change.
Right,
It's
right.
like the convertible part or something. Yeah.
Okay.
After a while, we need to change. Like maybe 2,000 something shot,
Right.
and
Yeah.
we need to change the applicator.
So Chinese, I think we need to move on to the next machine, you know. Anything that you want to
Yes.
summarize
Okay. Yeah.
or you want to add on regarding this machine, and anyone
To,
else from
to
the audience?
summarize, this new innovate. Yeah, you can. Okay, that can. That time you can. To summarize, this kind of device very safe and feel comfortable. Just keep the applicator contact to the skin and ask the patient all the time how do they feel. If they feel too much, we need to adjust the level. That's all. And we try to avoid some dangerous zone, some nerve branch. But actually, I think it's very safe from my perspective. Even do not do it too much on the some dangerous area. That's all. Okay, this is another machine, the cool face. ต้องตั้งก่อนนี่เป็นหัวเลยนะ ของ face เนาะ Okay, this is the facial tip, the cool face device. Okay. This is like the RF machine with the, it's called mini refrigerator at the tip. At the tip. So the tip feel very cool now. Okay, อันนี้จะลองอีกฝั่ง Oh but ต้องใช้เจลของเขาอะมีเจลของเขาปะ Yeah ใช้ฝั่งนู้นใช้ฝั่งนู้น
Yeah, so can you explain to us the mechanism of action of this machine? I'm totally clueless about this machine. Is this an RF
Yes.
machine?
For, this is RF machine, monopolar RF. So this device, this device you need to have the electrical pad. Electrical pad that is, on the
Yes.
back, on the back of the patient. And this is the applicator. Applicator is the monopolar RF device that it will, send some energy like this.
It's called cool face. Is it because they spray some cryogen in it?
Yeah, because it's not cryogen. It's just the tip, you know. The tip,
Cool tip
very
only lah.
cool here. It's like you, cool tip, just,
Yeah.
just the cool tip. It's like you try to lure her that, oh, it's cool. But actually it's sent through some heat. รู้สึกอะไรไหมเฉยๆ Oh, okay.
In this machine,
And
I
when
include
we do it, we need to
vibration
see the
with
monitor.
cool or only cool.
Put the RF energy
Okay,
through,
okay.
to her skin
Do you have vibration
with the
uh,
cool tip.
in this procedure? Because it's very good on stage of the skin when we used another machine
Oh.
with vibration. No? Only cool?
Yeah,
Okay.
only cool, but there is some the blue color on the monitor. You know, this is like the temperature, the thermometer as well. This if we do this and we see, oh, it's too hot, we can make the rest sometime. You can see this is theเจ็บไหม She said she doesn't feel anything. So this is the good thing. If you have more fat tissue, you don't feel anything at all. We can increase the level a little bit. So you can see that
how
my
deep
technique
do you
need to
think the energy
communicate
goes
with the
into?
patient. Should maybe should how deep?
Yeah. How,
3.0 millimeter.
maybe less than that,
But-
you
but,
know,
yeah,
because
and
you're
we- and we
targeting the dermis now, right?
Yeah.
Right.
It's like we don't just target the dermis only. It's like we can target something that is beneath. Because, you know, you can make the coagulation effect, or you can make stimulate the collagenesis, the new collagen synthesis in the same
Yeah,
time.
yeah. So
The endpoint is the redness
I
also.
think that the main target got to be the dermis lah, when you want to stimulate the collagen and everything. So you're saying maybe some of the heat goes
Okay.
deeper inside, right? Deeper down to the fat layer. But the
Yeah, some of the heat go deeper.
main target obviously not targeting the fat, right? So because if
Yes.
3.0, then maybe it's the fat layer. I think the dermis layer maybe 1 to 2, maximum 2 millimeter. That's all. I think.
Yeah. So, so it's like, but but the cool face we can do in Thailand. It help for, you know, when you do it deep. After a month, the fat goes smaller. Maybe because some fat tissue got necrosis or something, and that's the effect that people want. They got smaller shape of the face, smaller face. ไม่เจ็บไหม?
Do you prefer to combine these two techniques in one session, in one visit?
Yes, we can do it in the same time. But we need to see the monitor. Like if you remember, ดี๋ยวดูจอ this monitor, there is the thermometer like this. The temp, the blue one means, oh, not too, but as you can see, uh, in some area, if we put it too much, the temperature increase. And sometimes if it reaches to the red color, we need to change the area. So it's like this kind of device is really useful because we can monitor the temperature.
But I just want to remind the audience as well that FDA has issued a warning on radio frequency, especially the microneedling radio frequency, because at certain depths you can also cause fat atrophy, you can also cause burn, you can also cause blisters. Especially, I find it especially at the subzygoma depression there. So if you were to, do a lot,
Something.
if the energy is high enough, I'm not sure about this machine, but if certain machine, the energy
Yeah.
is really
For the
strong
psychoma,
enough,
right?
it can really cause fat atrophy, subzygoma depression, or the temples area. These are the one that you don't want to cause any depression. Otherwise, you're going to correct the complications as well. Of course, we can inject fillers, but then patient may not like it.
Yeah, need to be careful. You can see that after a while, her face looks smaller on this side. It's like a little bit lifting, just after a while.
But do you find that the effect continue to last? Because we know a lot of this tightening device is because of the heat. The immediate heat will definitely tighten the skin, cause a bit of lifting.
Yeah,
But
yeah,
the one that we want is always the collagen elastin stimulation that normally comes in
yeah,
2 to 3 months later. So
yeah,
do
yeah.
you find that
The thing
uh,
is we need to do the yeah. Sorry.
yeah, so do you find that the after effect is still there, that comes in later?
It comes in later. I think it will last for maybe a couple of months. But the thing is, in my practice, or or maybe the standard should be like we should do some before and after photo for every patient, because otherwise, sometimes they cannot remember her face. They cannot remember their face, so we need to capture, make the before photo. And all of my patients, after a while, after 2 months, they come and see, oh, it looks better. All of them, all of them. But if you don't have any photo,
1 minute.
they cannot remember her face. So we need to be careful for this. It's like the evidence, the documentation.
Dr. Chan, tell us please about maybe prepare the skin before machine techniques, or maybe after injection, uh, after treatment, BD.
Oh, for uh, Sorry,
Do you
can I
use
have the question again?
biorevitalization or therapy before machine's procedure?
Oh, yeah. If you do any treatment that help for the moisture issue, like to make her face more with more moisture, I think it's good. Just, just, just be careful about some treatment that can cause some contamination or not too sterile. Need to be careful. Like if you inject a lot of filler, inject a lot of collagen to her face, maybe you need to be careful. It will stimulate some inflammation.
Okay, Dr. Janice, I think we have
But
come.
for myself, sometimes
Sorry, I think we have
yes,
come to the end of your sessions. So anything else that you want to
yeah.
highlight to us?
Uh, this two device can do in the same time on the patient with no serious side
Will you
effect,
introduce
and they will feel comfortable. ตอนนี้
Okay,
เจ็บ
okay.
อะไรไหม She said no pain at all. So like this, this is just the just the example, But in my practice, maybe some people, we do it for a very long time, and she feel not too painful, and that's the thing that we like.
Okay.
Because in the old machine, old time machine, we need to some HIFU or some IF machine, we need to block, do the nerve block, or even we need to do the numb cream, anesthetic cream a lot. So this kind of device is very useful because you no need to list yourself, because sometimes the patient can be allergic to numb cream as well,
Yeah.
or allergic to some nerve block. So
Okay.
this no need to do to put the numb cream
Yeah.
to
Okay.
her.
Thank you, Dr. Janice. Okay, let's move on to the next.
Thank you.
Thank you.
Yeah.
We need to
Yes.
introduce next speakers.
Can we move the video to the next?
Dr. Atinuj, we, we see you. And,
Yes.
and you?
Yes.
Everything is okay?
Okay.
Yeah, okay, you can start.
Everything
Thank
is
you.
fine. So I think yes. I think I need the slide presentation. Okay. Can you work with slide presentation from that?
Okay, thank you.
Yeah, we can see the
Okay.
presentation.
Thank you so much. Okay, thank you. Let me introduce myself. I'm Dr. Atinut Dongkao from Thailand, and today I'm going to do the live demonstration focused on how can we tighten and renew the abdominal laxity and also with the stretch mark treatment with the Endimet Pro Max system, which is the latest one. May I have the clicker? Sorry, ma'am. ขอคลิกเกอร์หน่อยค่ะตัวเอง
Or maybe we
Clicker
can
เลื่อนส
press
ไล
for
ด์
you if you don't have.
หมอจะปรับสไลด์ยังไง
Yeah.
Okay, thank you. Next, this is my disclosure. Next, please. Next. Okay, before we are going to start, let me talk a little bit about the technology because it will be all we are going to go through for the live demonstration. Next, please. For the conventional radio frequency machine, we have bipolar radio frequency that will give the energy a little bit shallow. And we have monopolar radio frequency that can create the deep bulk heat. But anyway, it requires a very good cooling system. And from Endimet, we have the 3D radio frequency that have multiple pair of electrode, as you can see. The energy will go through, and it helps with focus the radio frequency to have the control and deep volumetric heating. It can go deep down up to 6 millimeter. Next, please. For radio frequency, its work in two ways. The immediate effect from heat that make the collagen contraction, and we also need this one, the long-term effect from the collagen remodeling that will appear for the next 1 or 2 months after doing the treatment. Next, please. For EndyMed system, we have 3 machine, the peel, the blow, and the latest one is the blow mac. The difference is that the blow mac we have increased the maximum power up to 100 watt. And with the microneedle radio frequency, it has 5 tips that I will mention later, and it also comes with the built-in thermal camera scan. Next, please. This is the thermal camera in action. You can see real-time temperature also from the built-in camera, and also for the control mag, it also has the temperature sensation at the handpiece as well. Next, please. In EndyMed, we have the focused radio frequency. Anyway, today, because we are going to talk about the abdominal laxity and stretch marks, so I will focus on the vacuum assist radio frequency, the radio frequency, microneedle radio frequency, and the last one is the fractional resurfacing one, the FSR. Next, please. Next, please. Okay, the contour max, it consists of the 3 deep radio frequency energy in combination with the pulse vacuum suction. So it is work well with the body contouring in the large area and the cellulite treatment. Next, please. The FSR Max has the dual action technology. The first one is the fractional resurfacing, so it works superficial, but it also has the deep volumetric heating that can heat deep up to 3 millimeters. And it works well for texture refinement or any wrinkle, fine wrinkle, or the scar. Next, please. For the intensive max, it is the microneedle radio frequency with 25 gold plated. And for the max one, we can increase the maximum energy up to 35 watt, and we can adjust the power width from 60 to 500 milliseconds. So we can apply the treatment for a more wider problem of the patient. And for the blow max, the tip has quicker treatment for the needle insertion and the needle retraction. Next, please. Here, the intensive max, we have the Hyper Zebra, Hyper S, Hybrid S, Hybrid M, and Hybrid L. Next, please. The Hyper is 100% non-insulated needle, so you can use it as the drug delivery channel for skin glow or the pore treatment. For the Zebra, it is the alternative segment of abrasion and non-abrasion one, so it works well for scar and axillary hyperhidrosis. The Hybrid S, it has the active non-thermal, non-insulated zone at the distal 0.6 millimeters, so it's suitable for a delicate area like periorbital or perioral. For the Hybrid M, it has the distal active zone at 1.5 millimeter for mid-dermis level, and the Hybrid L for the deeper level. And you can also treat for the cellulite with the Hybrid L. Next, please. This is some clinical result of the I5 MAC for periorbital. Next, please. And for the submental with the small max, it's the radio frequency. Next, please. FSR max, actually you can treat FSR from the face, the neck, the body, the décolletage at the back of the hand. You can treat it all over the body for any skin crepiness or laxity. Next, please. the mini shaper for a small area of the body. Next, please. And this is the case of abdominal laxity and some of the stria. He used the combination of the hybrid S and the contour and before and after result. Next, please. So I'm going to introduce a little bit about the case demonstration. Next, please. She is a Thai female in her 29 years old, postpartum of 10 years, and she has skin type 5, okay. Her main concerns are the skin laxity, the white stretch mark, and also she wants to reduce a little bit of the circumference reduction. Next, please. So the treatment plan that I plan for her is I will use the Control Max for circumreduction, Intensive Max with the FSR Max. Next, please. Since we have a limited time, so I cannot perform the Control Max for today, but these are the treatment plan for the Control Max. For the Control Max, you can have the patient to come back to repeat it like once every 2 weeks or once every month. Next, please. And with the Control Max, you can see the real-time temperature at the tip for a safer treatment. Next, please. And this is the treatment plan for Intensive Max. I will use the 10-bar trip because I want to focus on the stretch mark with 8-week interval because I want to wait for the collagen remodeling process. Next, please. And I will use the FSR Max for texture improvement and skin laxity with the 2-month interval as well. Okay, so we are moving for our case then.
Thank God for the introduction. Otherwise, we'd be so confused with so many hand pieces there.
Yeah. I want you to, okay. I want to show the Contour Max. The Contour Max is very ergonomic. You can grab it here, and it will have the power. It will show the power and also with the temperature here, and you can adjust the level of the energy here as well, and the vacuum. So, okay.
So can you help us to
As I mentioned earlier,
recall back again that
yes.
the Pro Max, that the Max is for targeting where the fat layer, is it?
The max because it increased the maximum power from 89 to 100. The Pro we have maximum power at 89, and the Pro Max we have maximum power at 100 watt.
So the difference is.
And the Pro Max we also, yes.
It is so besides the energy, the depth also is different, is it?
The depth. Actually, the depth of the needle between the Pro, if we're talking about the intensive or the fractional microneedle RF, the depth is also the same at 5 millimeter. But it different in that the Pro have only the hyper tips with the maximum power watt at that less than Pro Max. The Pro Max has 5 type of tip as I mentioned earlier, and the maximum power watt at 35 watt. And the wider range of the power width from 20 to 500 milliseconds. Okay.
So if you want to reduce the fat, sorry, if you want to reduce the fat, which one would you use?
Yeah. If you want to reduce the fat, you can use the Control Max for that I have already shown for the bigger area like the abdomen or the thigh. But if the patient has smaller abdomen or if you want to treat around the arm, you have to use the shaper. The other one that I won't demonstrate today.
Yeah, okay, sure.
Okay, so let's go back to our case, okay. Can you focus on her abdomen, please.
Do you need any anesthesia for this? Any numbing cream for this?
Actually, for the contour, we don't need the numbing cream, but for the intensive and the FSR, we need to apply the numbing medicine for 40 to 60 minutes. Okay, and I just want to show that here, this lady has already do the contour max. So you can see some immediate tightening here, compared between with the non-treated side, and a little bit of the redness here. Okay, and okay, and I want to show about the intensive max. You can here on the screen. Back to the screen, please. Okay, at the screen, you can choose the area that you want to treat. It has default parameter, the width, the depth, and the power. Since I want to use the intensive max for the white straight mark in this case, so I want to increase the depth of the needle to 5 millimeter with the default setting of the machine with 110 pulse width and at the power at 15 watt. And before doing the intensive and FSR treatment, you have to do the test pulse 5 minutes first, and you have to see the skin reaction. If it's too red, you have to decrease the level of the energy down. But if it no reaction at all, you have to increase the energy up. And here, I prefer to do the continuous shot. It means that only one foot switch place, it will continue doing the treatment for you. And for slow, moderate, fast, it depends on your preference. Okay, I'm now going to start the treatment. In this case, I will focus on only the stria alba. Okay. For the treatment, you have to do the treatment perpendicular on the skin, fully contact.
Dr. Atinic, how long after the baby is born do you prefer to wait before procedure?
Actually, we should wait until the blade feeding is finished. For me, because actually for the procedure it has nothing at all with the blade feeding, but sometimes the patient might concern about their baby health, so I prefer to do it after the blade feeding is finished.
Can I double check with you? This needle, this needle is going in 5 millimeter, is it?
Yes, now I use 5 millimeter.
Oh, and yet no pain.
You can adjust the depth.
No tumescent, nothing, is it? No tumescent, no numbing cream.
No. Just apply the numbing cream, no tumescent injection.
Oh, so there is numbing cream there, okay. And it looks like very small spot size there. What's the spot size there?
10 square millimeter.
10 times 10.
10 square millimeter.
Yeah, I suppose it's a 10 millimeter square there, right? But how do you prevent,
sorry.
how do you prevent the, I mean, 10 millimeter is quite hard to do it very smoothly and no overlapping. There will be some escape area where you miss, right, with the 10 millimeter.
Yes, I prefer to do in. Sometimes I do a little bit wider area, and then because we are going to see some immediate redness, so I can see that.
So you go back second time.
Area that I missed, I will repeat it.
I see.
Yes, yes.
And how do we
I
pre...
prefer not to do it too close.
So at 5 millimeter, potentially we can also cause fat atrophy, right? How do we prevent that? This irregular atrophy,
Uh,
in case it happens.
yes, yes. So you better do it with start with the low fluent first, not too aggressive to prevent the fat atrophy. Okay. And for abdominal laxity and the stretch mark, you need your non-dominant hand to stretch the skin to confirm that the tip is fully contact. Because if the tip is not fully contact, it might cause some uh, complication like the mark or the burn. Okay. Now, assume that have finished for the straight mark treatment. We are going to move to the FSR handpiece. The FSR handpiece is the fractional resurfacing one that I already mentioned that it has two mechanisms. The shallow one for the skin resurfacing, and it also creates the deep volumetric kitting up to 3 millimeter. So the reason that why I use the contour, the intensive, and the SSR combining together, because for the stretch mark, it's not only one single layer, it's not only about the surface problem. It consists of the germ elastin reduction and also with the collagen denaturation and combined with the
Yeah,
skin
Dr.
surface.
Atinus, sorry
I use the
sorry to
contour
interrupt.
preheat.
Sorry to
Yes.
interrupt, but the time is up, you know. Can you just quickly show us a little bit about
Okay.
this final handpiece before we move on to the next one? Already?
Okay.
Yeah.
Um,
I'm sorry for asking
yes.
too many questions.
For the other handpiece it's okay. For the abdomen, now for skin resurfacing, I move to the FSR Max handpiece. And we can select the area of the treatment here. I will increase the power a little bit, but the power I will stay at 3 watt because he has skin type 5. And for this one, it has the sweet ash, the handpiece. I will focus on the skin laxity. Okay. This one you have to file one shot per one. It has no continuous mode.
Okay.
It has only single pulse mode.
All right. Yeah. So any last thing that you want to highlight to us before we move on to the next speaker?
Yes. For me, treating the abdominal laxity and the stretch mark, we need to focus on the triple layer. With the deep thermal heating, you can use the radio frequency, the 3D one. For the stria, the stretch mark, it like the dermal scar. So you need to do like the intensive. And without the FSR max for the skin resurfacing, you can see you might see some different between the treatment area and non-treatment area. So for FSR Max, it can help with smoothing of the non-treatment zone and the stretch mark zone and the normal skin zone. And after doing the treatment, we should apply a lot of the emollient. You can apply some antibiotic cream, but there are no need for oral steroid or oral antibiotic. And tell the patient to avoid too tight, the clothes that are too tight.
Okay.
That's
Thank
all.
you.
Thank you,
Thank
Dr.
you, Dr.
Anish.
Tinosh. So our next
Thank
speaker
you.
will be Dr. Kyoprasom Nisha. She's going to tell us about this platform to rejuvenate the face. Yeah, so over to you, Dr. Nisha. Yes, we can see you, Dr. Nisha.
Good afternoon, everyone. Can you hear me clearly?
Yes.
Perfect.
Line.
Good afternoon from, yes, Yes, so today we are going to demonstrate the Widen's technology. So we start with one of the exclusive wavelength, which is 1340 nanometer for the patient that's got acne scar and rough skin, and he has like dilated pore size. So that's the first step. And then the next step, we do a combination of treatment with the hand pico, which is very exclusive as well from Widen's. And we deliver the wavelength to treat the stimulate collagen, and then the last treatment will be toning mode. So we do the combination of treatment to rejuvenate the skin, to fix all the problems. Yeah. Yes. So we're going to get started with the first handpiece, which is 1340 nanometer. We want to treat the mid-dermis first, so we set the parameter at the 400 microscopic treatment zone per square centimeter, and then we set up the fluence to 16 with the 5 millisecond wavelength. So we're going to get started.
Can you tell us which
So
chromophore
patient's already numb,
which
so
chromophore are we targeting with the 1340?
yes. So the 1340 nanometer will target mainly water, and then a little bit of hemoglobin and the melanin. Yes. So I'm going to do single pulse, non-overlap. For the whole cheek.
So it is a fractionated, non-ablative.
Yes.
Yeah.
This is fractionated, non-ablative, and the patient is quite comfortable when we applied local anesthesia. And this one will stimulate the neocollagenesis. And because it's so precise with the water chromophore, then the collagen will be rebuilt. And also, it touches a little bit of melanin and hemoglobin. So if patient has a little bit of hyperpigmentation and microvasculature, this also help improving as well. So can you turn? So you can see the end result is mild erythema. I'm going to do one pass, and then the next one, we will treat the same area with the hand pico. Yes. So this way we change the handpiece.
Okay, so we have we have
Easily.
Dr. Valeria here
And
with us also.
can reinstall.
She's very well versed with
Pardon?
this. We have Dr. Valeria here on the stage with us also. Yeah, so she also can help
Yes,
to
please.
explain while you demonstrate the machine as well, right?
Thank you. I have a lot of
Yes, that would be so
experience.
kind.
Yeah, no, it's like I'd like to share because it's such a special wavelength. What's special about it? It's less absorbed. It's absorbed by water, but it's less absorbed by water. What does it mean? It goes deeper. It's a neodymium IAP. So when I really want collagen, that's the wavelength I like to use it. Compare, for example, for the 1550 or 5040, it's 10 times less absorbed by water. What does it mean? That you are capable of going deeper. On this case, because it's a young guy, and here he wants more like a, it's not that he want to target it deep. So you use the 400 microthermal zone because you want to move more tissue. But if you want like collagen, then you go for 100 more energy. The more energy, the deeper. It's my favorite treatment when you want like acne scars or like strias. It's a very versatile handpiece. It's good for Asian.
And a pain score.
And now we are going to combine it
Depends on.
with the pico laser.
Here, we are not going too deep. So you want more like remove of, like you want like rejuvenation of the porous. When you want go deeper, I consider it medial. It's not like a ablative, So then you use numbing cream here, but
Do you use?
she used it. But
Okay.
I wouldn't consider it necessary on this case because he's a man. You know how men, I don't know here in Asia if you're tough in
Agree,
Brazil,
agree.
like
Yeah.
I always use numb cream when it's a man. If it would like you, I wouldn't use. I'm sure you'll say, oh, this is no painful. Yeah. It's much easier for the
Yeah, of
females.
course.
But I'd like to highlight that I have experience with many. I've been working with laser for more than 20 years. I had the opportunity to do my fellowship with Rox Anderson at Harvard, and I really considering this one of my favorite wavelength. Tomorrow I have a talk about it. I am not demonstrate because I don't have the license here. What I think I agree. Like, thank you, Dr. Avisha, for doing this for me. And it's very helpful. You
Thank you,
can
Dr.
use for
Campos. That'd be so
combination.
kind of you to.
Why we cannot see? Give her here.
Yeah. So with the guidance
If you look
and
at
the
it, you
new,
have some redness,
Little bit.
experience,
a little bit.
Yeah.
But the more you have energy, the more visible. But it's a no ablative.
Okay.
And I'd like to highlight something that's very special about it. I'm going to show tomorrow. Is for rejuvenation of the lips. I've been done a study in Brazil with my resident. It's good. Sometimes you forget, you treat the face. And I hardly recommend it to go into the lips. It's very good. And you can remove because when you get older, the color will change and you lose it. And for that patient want a look more natural, don't want filler, this is an excellent choice. And there is another indication, it's for hair loss. We've been using it for hair loss, and then you use the same handpiece that she's using is the one that we use for hair loss. Low
now we
energy,
finish with the
excellent.
combination of the first pass of
So
the
far, has
hand
there
pico.
been publications for that?
Yeah.
For the hair loss?
Almost.
Almost. Okay.
We're almost there. Yeah, was accepted. I cannot tell details still, but yeah. And what is interesting, yeah, I'm gonna tell. It's good for prevention. When you have that patient who go like to lose weight, if you started before, it's not that we are going to prevent 100% of the hair loss that usually happens, but you can decrease it. So it's an excellent indication.
Hand pico.
This procedure look like very easy for patient.
No.
He sleep maybe right now.
Yeah, he use it. Yeah, it's not that painful treatment. I consider it like meter. And now she's gonna show the pico laser hand pico. Yeah, the
It's
hand.
very
pico.
comfortable procedure. Exactly.
Depends on how much energy. I wouldn't say that high, like,
Yeah.
but sometimes like we do use numbing cream.
So it's the same machine with just so the picosecond is also using the 1340 as the wavelength.
Yeah, it's the same platform.
The same platform, right? Just the pulse duration is different.
Now you need, you need like the pulse duration is the wavelength is different. That's 3040. Now we are moving to the 1064. It's another,
so there are two wavelengths in this machine,
Yes.
is what I'm
No
saying.
more. We have. It's a
Yes.
very
We
versatile
are going to
machine.
do the
You do have
1064
the
from here.
5040.
It's
We have two
activated
no
on
ablative. You have ablative. That's the erbium, and then you have the
All-
1064.
All in that machine or a different machine?
Only in that machine. Now you know, like I do have a conflict, but I have many lasers on my own clinic, and that's my favorite platform. Exactly because it's so versatile.
I shoot it now.
Now is the pico.
You do. Let me change to
So the Pico is the 1064 NDR.
Yes, and we do have the 532. And we have the pico is interesting because like it gives the energy in such like a fast that you don't have that residual thermal effect. Like this morning, I was I think in this room and talking about treatment of ethnic skin, and they Cartier, with Cartier said, "What's your favorite machine to treat it like ethnic skin?" Pico, because the heat produces post-inflammatory hyperpigmentation, and then we can use in two ways: collimated, like when you want like to give like remove the pigmentation, and then you have a second one that's fractionated. So it's a lot of energy concentrate in different points. Then you are capable of produce the LIOBs, laser-induced optical breakdown. It's the plasma inside the skin. That it's a game changer. My treatment with melasma changed a lot because like you produce collagen without have the heat. So it's good for melasma, it's good for men that don't like that, always saying bad things about men. And you have like better results, not too much downtime, and for porous. So this combination, the 30-40 goes deeper and more superficially, you treat with the picosecond.
Dr. Campos, we are finished.
Sometimes I use, like you're talking about
Can
this
you-
platform,
yeah.
I use 5 handpieces on the same session.
Okay, yeah, we can hear you. Yeah.
Yes, so just to inform that we have finished all the 3 parts of treatment already, and this is the end result. You can see mild erythema, and the pain is, how much is the pain? เจ็บไหมคะ? He says it's good.
He's dead.
So patient is well tolerated with
He's
the
not there
treatment.
anymore. No, but it's not a painful treatment. I don't know about you, but after the pandemic, my patient cannot tolerate much pain. I think something changed. We are more nervous. I don't know. Like, patient don't want downtime. Patient don't want pain. So that's why I like this kind of treatment. I was the time like before, like even the laser to be pulsed before even the fractionated. Nowadays, no one want that downtime like a month.
For Asian skin, I think this parameter should be suitable because Asian skin tends to develop like PIH, which is more. And with the, this technology, I hope that he will heal up well, and with the nice result that we should observe later.
I can guarantee that you heal well. And I can guarantee, like, we have experienced up to skin type 6 in Brazil. And the procedure were done by my resident. Sometimes the resident don't do. We did like studied with 60 patients. No single case of post-inflammatory hyperpigmentation. So it's a very safe machine. I think this is very important. We have results, but we need to think about the safety.
Only sunscreen cream and yes.
Uh,
Only sunscreen cream on that's all. Yeah.
I always like it. I do have a integrated skincare. It's not just for the side effects. 15 days before, I like to ask the patient to use like vitamin C topically.
Okay.
But it's not just about side effects. I really believe it. I'm part of a group where we sat together, like I studied about integrated skincare. For those who want, I can share with you later on what you could do before. It's algorithmal, before, immediately after, between. And I truly believe that the results are going to be much better.
Does anyone else have any questions from the floor? We still have 5 minutes to go. Or anyone has any comment?
So I want to give a tip if no one has a question. As I said before, this equipment has like another handpiece, it's the erbium. And the erbium is ablative laser, and we cannot forget that any laser that reacts with your skin is capable of increase the penetration of drugs. And I would finish this treatment with like erbium. You don't need to be too aggressive, just to be like light, and you can apply whatever. Like my favorite combination, and I do have a study with Jill Jable showing that the vitamin C after the procedure can decrease the downtime. And we did a similar study in Brazil with exactly the same machine, showing that the use of vitamin C after the procedure for 3 months made a statistically significance in terms of wrinkles. So it's not just the heal, it makes fast. So we are physicians. Do the best, prepare your patient, do your follow-up, this integrated skincare. You can comment. So you can use like, sometimes you decrease the energy and you use 5 different handpieces in the same patient. This machine has one handpiece that you can use intraoral. It's very good too. The IPL, it's very useful too. And I would hardly recommend that one IPL that has the cutoff filter like 695. So use just the longer. So for Asia, because sometimes people are afraid of they use the IPL, it's a great handpiece as well.
How often you prefer to repeat this procedure?
A month.
A month,
Yeah,
1
a
month.
yeah. Because before I have to do everything with the winter,
Yeah, yeah.
and winter in Brazil is like
Yeah.
a month. So now with this, we can do even during the summer.
Okay.
So it's not that you need to squeeze and do everything fast. If it's too long, sometimes the patient don't come back. If it's too short, it's too short. So 1 month, but could be shorter.
Okay, if we have no other questions, then
Okay.
maybe we can
Thank
move
you
on
so
to the
much
next.
for
Thank
the
you.
opportunity
Thank
to
you.
be here. It means
Thank
a
you.
lot to me. Thank you, Visha.
Thank you, Dr.
Okay, thank you, Dr. Nisha. Okay, let's move on. Yeah. Okay. So our next speaker will be Dr. Araya School Smith. He's going to talk to us about ultra clear skin texture and excess skin on face. Yeah, I can't hear you, Dr. Smith.
System.
Yes, yes, we can hear you now. Yeah.
Can you hear me?
Yes, yes.
Yeah.
loud
All
and clear.
right. Yes. Okay, so I would like to demonstrate the case with the outer clear system. That actually it was the erbium fiber laser, which 2,910 nanometers. So actually it was a fractional erbium, and it can demonstrate with multiple of the chief complaint of the patient. So in this case, I would like to explain his face first. May you see the patient face? All right. So I have marked some of the problematic area that he has got very deep acne scars, which is when I extend the skin, you can notice that the scar is not gone. So this is a kind of a box scar with the fibrotic tissue underneath. And also there are other problems around here, which is skin quality problems, that he has got multiple of the static lines around here. ลองยิ้มได้ไหมครับ Okay, can you see? There's a lot of the wrinkles around here. And I would like you to focus around this area, around the eyes, that he has got the skin laxity, skin excess problems. When I pinch the skin, you will notice that the recoil of the skin has not really great. So this is the area that I would like to treat. So with this system, they come with multiple mode. Maybe I will shift to the screen. Okay. We will notice that in outer clear system, we have multiple mode. There are 3D miracles, which aiming for the skin quality. There are outer clear mode that's aiming for the skin remodeling and heat remodeling, and also the one with laser coring, which is bigger in the diameter, that aiming for skin tightening and also for the skin excess problems. So in this case, I would like to demonstrate first with the laser coring mode. In this mode, you can see that there are multiple patterns that we can choose. We can go really precisely with square, rectangle, or any other shape. Personally, I would like to start with coring mode first because I would like to see the reaction of the skin and really watch out for something that need precision on the treatment. I will start with the acne scar with box scar that need the fibrotic tissue removal. So I choose the shape as a circle with diameter only 7.5 millimeters. The coverage may be a little bit high. For Asian skin, usually I not go higher than 5%. And the depth of the skin around the cheek, I would like to choose around 1 millimeters. So yes, I would like to start the first mode for the treatment. Usually when I do outer clear, I will wear the N95 mask to the prevention of the fume. But today for the demonstration, I will use together with the vacuum.
May I know the chromophores that we are targeting is water, right?
So you can, yes, water, because it's erbium. Yep. You can notice that I would like to start with this kind of the acne scars. I will go really precise on the scar like this. You see? In this kind of machine, it really selective, so I would go really selective on each of the lesion that I marked it before.
So can you explain to us the
All the
advantage
time,
of
yes.
this machine over other erbium lasers?
Of course. I think the differentiation between this system and another erbium is that the micropulses that we choose also can add up the coagulation. Yes, actually the right amount of the heat can create the surrounding tissue to have a little bit of coagulation effect that in normal classic erbium you cannot have that. Okay, and also that we have the coring mode. This one is very unique because as you can see that each point of the laser beam is quite bigger than normal fractional erbium.
Okay,
It's around 200 to 300 microns.
Dr. Smith,
yes, in
sorry,
the
sorry
diameter.
sorry to interrupt,
Yes.
but we have Dr. Diane Duncan here with
Yes.
us as well. So maybe she
Yes,
can
yes,
explain
yes.
to us
Good afternoon, Dr.
with the
Duncan.
slides, with a short presentation about the machines, so that it'll be easier for you also.
Yes, definitely.
Right? Can I invite Dr.
Yes, that would
Diane
be
Duncan?
great.
Yeah.
Yes. Please, please, please.
Thank you. Yeah, it's a bit awkward because he started the demonstration and, yeah, okay. So I'll briefly mention what Dr. Smith is doing. The Ultra Clear is a 2910 laser, and there are several modalities. I think it's a really great tool because it's so flexible. So he's doing laser coring now, which is basically, to me, the trademark of the laser, and this is unique in that the first coring device that came out in the US was called Ellacor, and it was mechanical only, so it only takes out tiny segments of skin. But the problem with the Ellacor is that the whole, it's kind of like a micro punch biopsy. The whole piece of skin did not come out. And so you're taking out the surface of the coring, and then the base of it got left behind. So in some cases, you'd end up with almost an acne scar type thing that you've generated. With this, all the tissue is ablated. You have basically, you know, he was doing, I believe, a millimeter depth and a 5% spray or distribution, and the 5% is really pretty high. And it will get a lot of depth out of the acne scar. And because of the distribution of dispersion, you're going to get a whole lot of coagulation that will make the tissue more vertically dense and therefore take out some of the depth of the scar, whether it's a box scar or an ice pick. So the next modality is the clear. So I usually start deep, as he's doing, and then I will use the ultra, which is dermal, and then the clear, which is a superficial, more ablative process. And so we just finished an epigenetic study. This was a superficial treatment ×2. We did 20 patients at 2 sites, and we did the standard, very superficial 3D miracle treatment. We did 2 treatments 1 month apart, and did, in addition to photographs, a tape strip analysis, which analyzed DNA methylation. So this is a very sophisticated study. We're looking at an age regression analysis here. And you can see the differential methylation analysis showed that at day 60 versus 30, this was where you saw the peak of the age regression between at day 30 after the second treatment and day 60 after the second treatment. So we saw an age regression analysis of about, for these very superficial treatments, 0.57 of a year. And the increase with age over time, you're going to see quite a bit with the not very well treated, but the increase with age, with time, is really diminished at the end of the 30th day to the 60th day. You're going to see a link to epigenetic age predictions and -3 years to in an N of 7. This was interesting because the patients who reacted with more edema and more inflammation had a better age regression. So the more responsive patients had a better result. In Asian skin, I like to prime and do post-care in order to reduce the risk of any PIH. So to date, I've not had any PIH in any of my Asian patients. So for priming, I'll prep the skin for 30 days, and I'll use topical tranexamic or kojic acid, and then avoid sun exposure. Avoid thermal treatments such as RF microneedling before the treatment. And during the treatment, I think it's important to cool the skin between the treatment layers if you're doing laser coring, then followed by a ultra level, and then followed by a clear level. I'll cool the skin with a saline cloth, and that will reduce your risk of PIH as well. Then I apply topical exosome serum as my post-care, and then the emollient-based exobalm that I compound myself. So here's a patient, and I think post-care plans are very important, that I did a really aggressive 4-layer treatment on, and I used laser coring, and followed by dermal treatment at 500 microns, and the ultra dermal treatment at 300 microns, because she wanted as much tightening as possible. And then I did the clear resurfacing, 45% concentration at 50 microns, which is basically clear plus, or fairly aggressive with all the layers. I did the topical ADS exosome serum, saline soak for 20 minutes, and then the emollient. And you can see with her picture, this is only 14 hours post-treatment, and she is 100% reepithelialized, but she does not have, she has some pattern marks, but her eyes are not swollen shut, and this is really a pretty, very quick recovery. One of the things that we were speaking about earlier in another session, for people who have challenges treating sebaceous hyperplasia, things like syringomas, you can see this woman who had really severe sebaceous hyperplasia. I treated her with the ablative setting on 80% density, and because of the post-care, then she was reepithelialized with 100% healing at 5 days, which is quite early for something that is as aggressive as that. I also treated her upper lip with ablation and her cheeks with laser coring. You can see how she has really significant malar edema and malar bags. I would probably go back the next time and treat that with a very light layer of ablation on top of that in order to get maximum skin contraction. And next, I'm going to show a brief video of, let me see if I can start the video, a patient of mine who had very severe acne scarring. Some of these patients who have really thick male skin, it's hard to get skin contraction. I treated him with, my videos didn't start, so I treated him with laser coring at 4% depth and, 2 millimeters of depth and 4% of density. And you can see that he's gotten not only pretty significant improvement of his of his acne scarring, but a really nice skin contraction. In fact, he looks like he's had a conservative facelift. And this is the one thing I would say is my take-home message. If you really want skin tightening without skin excision, minimal risk, and minimal downtime, this would be what I would recommend. Thank you very much.
Thank you.
Dr. Diane, may I know, for each laser beam, what's the spot size like let's say for the coring, the ultra setting, what is the yeah.
There's not a dial-in spot size, you know, so for the laser coring, basically you're setting a depth and a density. So the density, I guess, would be equivalent to what your idea of a spot size is. So a very conservative density would be 1%. Now 1% sounds like almost nothing, but in actuality, it's much more than 1%. So you're going to see your pattern marks are pretty wide at 1%. The 1% you would be basically using on body areas like knees and arms or décolleté that you're worried is going to take forever to heal. But in patients who have heavy sebaceous skin and a fair amount of thickness to the dermis, especially in men, you know, they have a better blood supply in their hair-bearing areas. I've gone 5%. In a rare case, I had one woman who had some stria on her breast and she wanted them gone. And I treated her with 5% and she got a nice breast lift out of it as well as 90% eradication of her stria. So I think when you're using the ultra clear, it's probably always good to start conservative in order to stay out of trouble. But it can give you pretty maximum results in cases that there's no other good answer for.
I was just wondering for ice pick scars, since you can't concentrate, you can't focus on that scars itself, right?
Absolutely.
Yeah.
There's a spot setting, and so if you have an ice pick scar or a kind of a narrow base box scar, then I'll do the spot because then that will bring the skin together really, and you can do single spots. So one thing we were talking about in the MCAS alert session is how some people will take almost a no-core needle or an 18-gauge needle and subsize the really deep ones, and then you would do the ultra clear with laser coring immediately afterwards. And that way, because your tissue is a little bit mobile, you're going to get a better result as far as thickening of the skin and uniformity of the skin surface.
Okay, can you proceed with the demo?
Yes.
Yeah.
Yes, Dr. Smith, to be continue, please.
Yes, okay. So back to the, thank you, Dr. Duncan.
Thank you,
Thank you
Dr.
so
Dan.
much.
Yes, so as you can see that in our coring mode on the acne scars, you can notice that the point of the beam is directly go through the fibrotic tissue of the box scar that we are aiming for. So I will shift to another part of the skin as Dr. Duncan present that the excess skin like this, we can also use the coring mode. In Asian skin, usually I prefer around 2%, not more than 5% of the coverage. So I will let you see a little bit of the setting here. I change the shape from the circular shape into the rectangle and the size of 10 millimeters with coverage around 3%. I reduce the depth into 0.5 millimeters since I will go to periorbital treatment. So let's do it together. You can see that I will be very precise on the skin laxity area. So it'd be like this. You can notice that I wear the metal eye shield inside the patient eyes for the protection. So you can see as a vectorized lifting around the skin access area, especially you can go on the palpebral part also, but skip the eyebrows because of course this is the ablative fractional, you may lose the hair, and I will do it in a vectorized way.
But it will grow back, right? Because it's so superficial, right?
Yes, but usually I will skip, yes, and avoid to injure the hair roots. So what we can see now is that the eyebrow is lifting and also the immediate effect of the coagulation. So I will let him sit up a little bit to see the eyebrows.
So do you adjust differently between the periorbital versus if you're doing on the cheek area? Because we know the thickness of the skin is so different.
Of course. Okay, come. Yes, what I adjust here with coring mode is the depth of the treatment. Since the skin here is thinner, I shift to be only 0.5 millimeters in depth. So I will do another side. So usually I will do it with the vacuum and creating the lifting effect.
What your recommendation about after treatment? Maybe exosomes, like Dr. Diana
Yes.
said us.
Yes, this is a very good question because since we open the skin, usually what I prefer, as this is the erbium laser, sometimes it's got bleeding problems. So I prefer to use PRP, maybe activated one, and also the growth factor that can help you with the skin remodeling and re-epithelialization.
In one session, yeah?
Yes, and also, yes, and also controlling the inflammation also is one of the key factors to make better in the results. All right, so I finished the coring mode, so I will go back to the main phase and then I will go for the outer clear mode. This is for the skin remodeling. I use outer clear, which you can see that it comes with the surrounding launching of the beam as a circular shape that we can choose the thickness of the rings that we wish to. In this case, I will use a ring 1. And also we can choose the depth of the both in the ring depth and also the drilling depth inside. Usually I prefer to go quite bigger in the spot size. And then for the skin quality, I will go a little bit deep in the drilling. And usually for the ring depth, I will go around 50. Coagulation in Asian skin, usually I prefer only one or none. You can do repetitive if you want it to be quicker. Okay. You see the skin area like this, that's got a lot of fine static wrinkles. I will do it around here. Yes, you can notice that if we do it in the right way, it's not much of the bleeding, and also we can do it precisely with the shape that really direct to the problematic area. I will be very focused on the problematic area.
Looks like
Usually the
very,
pain score will be very low.
but it looks like very dense. This
Yes.
fractional
Yes,
distribution.
but actually what you can see is that actually it was the ring that is doing the coverage, but inside the ring that is a drilling. So it maybe look really intense, but actually it's something that is really very easy to recover. So maybe around the eye I will reduce a little bit. Of the depth, for drilling depth, I will do only 300 microns and reduce the percent of the coverage. It will be 30 for around the eyes.
Does anyone else have any question
Another
from
side,
the floor?
I will focus on the problematic area. Yes, is there any questions? In the cheek, I will shift the depth back into 50 and 500. I think the advantage about this system is that you can go very precise on the depth that you are aiming for. And if you understand about the pathology, you can make it a very personalized treatment with the patient.
So you try not to overlap, is it? Zero overlapping.
Yes, usually I will be not overlapping because I don't want to make it too much of the energy launching into one area.
But
This is enough.
after doing this, right, do you go one round of very superficial, very mild setting to the whole face in order not to have this patchy redness on the patient, it's just for that few days
Of
of.
course, that can happen. Yes. Yes, it's also, I can demonstrate you a little bit for that because this is the problematic area that I would like to remodeling the skin. But in case that you just want to reepithelize a very superficial part of your skin, you can go for more gentle mode.
And does the
Okay,
patient
I think I will
complain
try
that?
to cover all of the static line.
So what do the patients tell you during the downtime? Because like
Yes.
patients basically tell me for fractional CO2
Yeah.
lasers, they felt that the skin is like a kiwi skin, you know, the kiwi
Yes.
fruit skin after that. So in this case, what kind of scabbing feeling that they feel?
Usually, of course, this is a fractional laser. There will be some scaling. Without any additional treatment, usually it will be around 7 days for the scales to shed off. But personally, I will use the activated PRP and can reduce the downtime for a few days. Usually in my practice, it will be around day 4 to have a clearance of the scales. So I will demonstrate what you are asking about very superficial one. Usually I use clear plus mode, which is for the reepithelialization of the keratinocytes in the epidermis. You can go bigger in the square shape of the treatment zone. And usually I go not too much depth, it's around 40s and not of the coagulation. It will be like this. In this kind of treatment, it's only a few days. It will be better. I think in his skin, I need the depth like this to make it more coverage for the skin remodeling. Without drilling, because this area is less serious in the problem. But in case that the skin is really clear like this, maybe I will go less with the clear mode that is even more shallow. The smallest, the shallowest one is 5 microns only, so I go around 10 usually, and then I will go for the coverage of the treatment.
I see some hypertrophic scars on the jawline, you know. Do you use it to treat those hypertrophic
Yes.
scars?
Yes, of course, that I can use it, usually combination with the topical steroid, yes, after you open the channel. I think that's also giving you an excellent results. So this, I will try to cover everything with a very superficial treatment to make the skin even.
Thank you so much, Dr.
Do I
Smith.
still have time?
Thank
Okay.
you.
I will
Yes,
try my
we don't
best.
have a time, unfortunately. Thank you so much, Dr. Diana, for introducing
Okay,
this
yes, I hope
procedure.
you see the big picture of the treatment. Thank you.
Thank you.
Okay, thank you everyone for staying back.
Thank you.
And hope to see you tomorrow. Thank you.
Thank you. Have a good evening.